Now I want to talk about neonatal and childhood blood volumes. Now when you look at some literature, you sometimes read that the blood volume in a neonate is 78 mils of blood per kilogram of the body weight. And this is quite a distressing figure to read, and I suspect you might know the reasons why. Because if cord clamping is delayed by 5 minutes, this increases by 61%, studies have shown. So if the cord is clamped straight away, as has often been the practice, 78 mils per kilogram is what you might expect. But delayed cord clamping for 5 minutes, and that increases by 61%. And it increases up to 126 mils of blood per kilogram of the child's body weight. So what we could say is that this is the pathological iatrogenic figure, and this is the correct physiological figure when cord clamping is delayed. And it's hard to keep scientific about this because it really makes you angry that this is what we've been doing to babies probably for generations, and this is what the situation should be in the light of modern physiological research. And this increased 61% works out at a 3.5 kilogram neonate. That works out at 166 mils of blood. So a massive increase in the amount of blood from this placental transfusion as the blood drains from the placenta. And studies have found that stripping the cord doesn't actually make a difference. You know, the way people strip or milk the cord to try and put the blood into the neonate actually doesn't make much difference. This is a very physiological process. And indeed, when we looked at the changes in the circulatory system at birth, we saw some possible reasons for this. We saw that the bradykinins form in the blood of the umbilical cord in response to lowered temperatures. Also, bradykinins were formed by granular leukocytes in the lungs as a result of exposure to gaseous oxygen. And we saw that these bradykinins physiologically constrict the umbilical arteries and veins and the ductus arteriosus as well. Even delaying cord clamping by 15 seconds gives us about 25% of the benefit, and 60 seconds gives us about 50% of the benefit. So even delaying cord clamping by 60 seconds means we're going to get about half of that volume. But obviously delaying for 5 minutes is the ideal situation. And not only is the blood volumes involved here, we've got all the wonderful stem cells that are in the placental blood and in the cord. And the combination of the increased amounts of blood and the stem cells can have lifelong epigenetic effects. Of that I have no doubt. So delayed cord clamping we see to be absolutely vital. Now, studies show that at 72 hours of age, the blood volume is 82 mils a kilogram. If the cord was clamped early, but if the cord was clamped late, that's still much higher at 93 mils a kilogram. So again, we see a much healthier 93 mils a kilogram as to what we can only call a pathologically low volume of 82 mils per kilogram if the cord was clamped early. And quite a few sources tell us that about 3 months blood volumes are going to be around about 85 mils per kilogram of body weight. And you do see some slightly different figures, but these represent what a lot of texts will say. 3 months, 85 mils per kilogram. First year of life, after 3 months, 75 to 80 mils a kilogram is often quoted. Children, 70 to 75 mils a kilogram. and that compares to the adult figure of about 65 to 70 mils a kilogram. But of course this greatly depends on the body weight of the adult in terms of adipose tissue. These figures are for ideal body weights. So if the ideal body weight is 70 kilograms, the actual body weight could be 85, 90, whatever, depends how obese the person is kilograms, which of course is going to greatly reduce the figure. Male adolescents and men, greater amounts of muscle mass, we normally think about 70 mils per kilogram, and female adolescents and women about 65 mils per kilogram as a rough guide to blood volumes. But let's just leave this video with this staggering difference: 78 mils a kilogram early clamping, 126 mils a kilogram delayed clamping of the cord.